Hello guys, I'm L'Oreal and you're welcome to my YouTube channel where I give you information on various health issues and remedies on how you could improve your overall well-being. Some individuals mistakenly think that you cannot get sexually transmitted diseases through oral sex, but the truth is you can actually get sexually transmitted diseases through oral sex. In fact, there are some STDs that are spread more frequently than others. This video I will be discussing how you can get sexually transmitted diseases through oral sex. If this sounds like something you would have interest in, I would like you to please sit back, relax and enjoy the video. And also please don't forget to subscribe to my YouTube channel, like and comment on my videos if you found what I have shared with you so useful. Any sexual act in which the mouth, lips and tongue comes in contact with the genital area is known as oral sex. Sexually transmitted diseases are spread through sexual fluids and skin-to-skin contact. It can also spread from the genital area to the mouth when an infected genital area comes in contact with the mouth. And also, if you engage in oral sex with your partner, sexually transmitted diseases that is present in your mouth can also spread to your partner's genital. The funny thing about these sexually transmitted diseases, you can have these sexually transmitted diseases and you won't even know, because most of these sexually transmitted diseases are asymptomatic, meaning that they do not present with symptoms. In cases whereby the sexually transmitted diseases present with symptoms, you can have lower abdominal pain, you can have yellow or greenish discharge, you can have burning sensation while urinating. Also, you find it difficult when you're trying to pee. You have this painful urge when you're trying to pee, urinate, and also you can have painful sexual encounters. And in pregnant women, it can lead to preterm birth, that's premature labor or underweight babies. These symptoms are linked to sexually transmitted diseases like gonorrhea, chlamydia and syphilis. So there are some sexually transmitted diseases that are caused by bacteria, and these are the chlamydia, gonorrhea and syphilis, and these infections can be treated with antibiotics. But in situations whereby you don't treat these sexually transmitted diseases and you leave it in your body to stay for so long, it can lead to complication. And such complication includes pelvic inflammatory diseases in women. It can also lead to infertility in men and in women. It can also lead to dementia, as in the case of syphilis and some neurological disorder. Sexually transmitted diseases that are caused by virus includes the genital herpes and the HIV and also the human papilloma virus. So this virus can remain dormant in your body for so long after you have been infected initially, and it can reactivate, like it can come back several times in a year. So what you present with is that your genital area will become itchy and it will be so painful. You have pains around the genital area and you also have sores, and these are as a result of genital herpes. However, there are times whereby this genital herpes don't present with symptoms. Yes, you might not have any symptoms or signs. So even if you don't have any obvious sores or you're not experiencing any symptoms, if you have this virus inside of you, you can still pass this virus. 9 out of 10 times, human papilloma virus infection usually goes on its own. But in situations whereby it doesn't clear on its own, it can lead to cancer and genital warts. So genital warts present as, you see them as small bumps around the genital area, or you see clusters of bumps around the genital area. Now, in terms of cancer, this human papilloma virus is the leading cause of cervical cancer. If you find out that you have this human papilloma virus and you don't track it earlier, you don't do anything to it, and you leave it to stay in your system for so long, it can lead to cervical cancer. So the rate at which you can get the human immunodeficiency virus through oral sex is minimal, but the truth is that it can still happen. Let's take for example, if you engage in oral sex with an infected partner, with someone that has this virus, and the person releases sexual fluid inside of your mouth. Now you should know that this virus is already inside the sexual fluid, and once it comes in contact with your mouth, and there is any opening, and maybe you have ulcers, you have sores, or you're experiencing bleeding gums, this virus can pass through that route. So that's why I said the rate at which this happens is very, very low. But receiving oral sex is thought to be less dangerous than giving. So if you're the one always giving the oral sex, if you're the one always giving the blowjob, your chances of getting these infections are very, 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 very high. Viral caused STDs do not have cure. Yes, they do not have cure, but their symptoms can be managed, and they can be managed with the use of antiviral medications. Then for genital warts, topical medications and surgery can be done. Topical medications involves applying cream to the affected genital area, and also surgery just to remove the genital wart from the genital area. For the human papilloma virus, it is advisable for you to go get your vaccine. So now that you know that sexually transmitted diseases can be gotten through oral sex, it is also good for you to know what to do in order to prevent the risks of having these sexually transmitted diseases. The only preventive measure for sexually transmitted diseases is to abstain from all forms of sexual activity. But you can lower your risks by getting tested for sexually transmitted diseases and ensuring that your partner also gets tested for sexually transmitted diseases. You should also think about being in a committed monogamous relationship with someone who has done STD, who has done sexually transmitted disease screening. So in this case, you should avoid multiple sex partner. Yes, avoid the rate at which you engage yourself in oral sex with different kinds of people. By this, you're going to reduce the risk of having this infection. Avoid having sex with someone that has a live herpes and genital wart outbreak. Yes, avoid having oral sex with someone who you are saying that the person has blisters around the genital area, the person has sores around the genital areas, or you can see bumps or ulcers around the genital areas. Please do not engage in such activity with such partner, and treating any STI as soon as possible with prompt care. When you get tested for sexually transmitted diseases and you see that you are positive for any of the infections, it is advisable for you to treat it immediately. It's not something that you have to leave, maybe you say in the next 2 months or in the next 3 months you treat it. No, you treat it immediately. The earlier you treat it, the better, because by this you're going to reduce the rate at which this infection can spread. Also reducing the rate at which you can have complications that normally arise from these sexually transmitted infections. So, and another one is to get the HPV vaccine for the human papilloma virus infection. The recommended age at which you can get this vaccine is from, I think, 11 to 12. Yes, that's the recommended age, 11 to 12. But sometimes you can also get it at the age of 9. So the reason why it is best at this age is because it is assumed that people of that age are not yet exposed to such virus. So it is better to get it at that stage in order to prevent the likelihood of having this infection in future. And also, if you did not get this vaccine at the age of 11 or 12 or 9, if you are below 26 years old and you know that you have not exposed yourself to the virus, you can also get this vaccine, although you can speak with your doctor about it. But after 26 years old, it's also believed that most people at this age should have been exposed to the virus in one way or the other. So it is not advisable that after 26 you go get the HPV vaccine, because it will be of less benefit. The aim of this vaccine is to prevent you from getting this infection. So in cases whereby you already have this infection and you didn't get tested and you're not even aware, and you say you want to go get the HPV vaccine, it will not work for you. It's not going to work because it doesn't cure the infection. What it does is to prevent you from getting that infection. That'll be all for today. Thank you for watching. Thank you for your time. Thank you for giving me audience. See you some other time, and until then, please ensure that you go for your sexually transmitted disease screening so that you can reduce your risk of getting these infections or complications that might arise from the infections. Please ensure that you take good care of yourself in order for you to live a healthy and a healthy lifestyle. Bye. Bye. Bye.